Namaskar and a warm welcome from IAPSM West Bengal Chapter as we bring forward a new fortnightly series, Public Health Chronicles, that aims to decode the remarkable stories of the different public health events that have shaped its journey. Interestingly, even our Public Health Chronicle itself has an interesting story. It was April 2026, a never before member mapping exercise, and a simple question asked: what more can we do from our association side? And you spoke, and we listened with intent. Many wonderful ideas came pouring, and so did a young mind and his ideas too. It was about a series dedicated to the remarkable public health stories and sharing with all. We promised to deliver, and today we have the great privilege of making that beginning. Because every public health story has something remarkable to tell. And it all begins with someone who dared to ask a different question. And with that, I introduce you to Dr. Prabuddha Goswami, junior resident in IPGMER Kolkata, who dared to think differently and brings you this Public Health Chronicles under the aegis of IAPSM West Bengal Chapter. And today we have another young mind as the guest of this very first episode, Dr. Rachit Harode from All India Institute of Hygiene and Public Health. So with that, over to Dr. Prabuddha Goswami and Dr. Rachit Harode to take you through the very first episode. Let's begin.
Thank you, ma'am, for your blessings and for that lovely introduction. So, without further ado, we'll set the ball rolling and welcome, Rachit. So, the first question which I will be asking you today is that tell me that can removing the handle of a single water pump save an entire city? I'll tell you, it does sound absurd, right? A handle, which is just a piece of metal.
Okay, now I need to know why that's even a question.
Good. Because in the summer of 1854, that very question arose. And I'll tell you how one man answered it. And quietly it became the birth of a whole new science. Welcome to Public Health Chronicles. I am your host, Prabuddha. And today we will be going back to a street in London that no one who lived through ever forgot. So this is actually the place where all the action happened, right? It's called Broad Street and it is located in the Soho district of London. Today it's a quiet, quaint corner with a plaque and a replica pump installed. And in 1854, this was the center of a nightmare.
Nightmare? What kind of nightmare are we talking about?
The kind, my friend, that could kill you within hours of your very first symptom. So let your imagination run a little wild and picture London in the 1850s. There's no real sewage system. There are cesspits under half of the houses in the city, and the Thames, the sparkling Thames as we know it today, is doubling as both the source of water, and an open sewer. And there's coal smoke hanging over everything all around the city.
So basically, if you had a nose, you were serving a life sentence.
Oh, absolutely. That's very well put, my friend. And exactly, the city smelled the way you expect it to. And with almost 2.5 million people crammed together, with almost no modern sanitation to smell. And into that world walks in a disease that England never really had to reckon with before. Cholera struck London. And in late August 1854, this is one image in a Soho neighborhood where people started dying and they started dying fast.
How fast are we talking? What kind of
Uh,
timeline did these poor souls actually have?
uh, I'll tell you. So basically, someone could be very perfectly healthy at breakfast and dead by nightfall. Severe vomiting, violent diarrhea, extreme dehydration, and dehydration so extreme actually the body simply shut down. And in the first 3 days alone, my friend, over 100 people died, and in the vicinity of a few streets of each other.
That's horrifying. It's practically apocalyptic. What on earth was driving this slaughter that rapid?
So that's exactly the question even all people in London were asking at that time. And at that time, almost everyone thought they actually knew the answer. And the answer which they thought to was the miasma theory. It was the dominant medical theory of the yesteryears.
Miasma. That's bad air, right?
Right. And the idea that disease came from foul smelling vapors rising of rotting matter, sewage, and decay. And honestly, given what Victorian London actually smelled like I described before, it wasn't really an unreasonable guess, right?
I mean, if I woke up every day next to an open cesspit, I'd probably blame the smell too.
Very fair, and absolutely there's no mocking the theory, but actually that was the prevalent theory during those times, and the reasoning to the theory was very simple nonetheless, right? So what it actually was, and it was downright elegant, if I may say. Bad smell meant bad air, and bad air, once inhaled, caused the disease. And it matched actually with what the doctors kept observing. Because the worst outbreaks of cholera kept turning up in the poorest and in the most foul smelling parts of the city.
So, in a nutshell, it wasn't bad science. It was just flawed logic. They looked at a room full of smoke, blamed the smell, and completely missed the fire.
Oh, that's a great way to put it, my friend. And miasma theory, like you said, wasn't really unreasonable. It was untested. And this theory is now going to meet our protagonist, a physician who insisted on testing it anyway. Meet our protagonist for today, Jon Snow. He is not yet famous, and he is not yet the father of anything like we know him today. He is just a simple working London physician. He is well regarded actually for his research into anesthesia, a completely different domain. And he personally was famous for administering chloroform to the then Queen Victoria during her childbirth.
Okay, that's already impressive. But what does an anesthesiologist have to do with an epidemic?
Oh, my friend, more than you think. And Jon Snow's whole career had actually trained him to ask a very specific kind of a question. And he did not ask, what does this look like? But instead, he insisted on what the evidence actually showed. And when cholera hit Broad Street in London, he brought that exact instinct with him. He started thinking like an epidemiologist. And Snow did not believe that the bad air explanation just added up. And if cholera spread through air, why did some households on a street get devastated while their next door neighbors stayed completely hale and hearty?
Well, that's strange. Bad air would not really care about property lines, right?
Oh, of course not, of course not. Not that I would presume. And that's exactly the kind of observation that John Snow made. So he asked a different question. He asked not who breathed the bad air, but what these particular patients actually had in common.
And what did they have in common?
And to find that exact question out, John Snow did something not anyone at that time actually dared to do. He went from door to door looking for an answer. So he asked families, he went around asking what kind of water they consumed, and he started what we today very famously know as shoe leather epidemiology. I'll show you one thing. This is actually the raw map that John Snow actually worked from. Before any of the data as we know now and as we associate with him. Just the streets were there were houses, and there was no pattern which was visible yet.
So essentially a crime scene with no evidence gathered yet. Pure baseline.
Absolutely, absolutely. That's how another erstwhile hero, Sherlock Holmes, would put it. And you, my friend, are my Watson for this episode, right? So you're absolutely right. And over the following days, Jon Snow actually interviewed families, visited the houses, and asked one deceptively very simple question of every household, as we can see, which is touched by the outbreak. Can you guess what the question was?
Let me. Where do you get your water from?
Exactly that. That's how simple it was. And this is what we now call actually shoe leather epidemiology, like I also mentioned before. So, if we take a closer look at this map, each of these red dots actually represent a case or a death from cholera. And it's actually stacked around the water pump, like we can see, right? And it's actually stacked around the house where it actually happened, like I'm showing you right now.
Oh,
Can you
wait.
can you understand the
Those are not
pattern,
spread out
Rachit?
evenly, right?
Uh, I'll urge you to take a closer look. What do you notice?
Oh, okay. They are piling right there at the center.
Exactly, exactly. That's that's the case piling right around this one spot, right? And
Yeah.
that one spot, my friend, is actually, and that my spot, my friend, is actually the pump which I showed you before. And John Snow had produced one of the first disease maps in medical history. And the pattern is absolutely very self descriptive, if you ask me. So, if we zoom in into this map, the clustering thus becomes absolutely impossible to ignore, right? As you said. And nearly every death actually traced back to the households which were closest to this single pump, as is visible in this map, right?
That's basically just a giant arrow pointing at the water supply.
In modern terms, yes, absolutely. And that is what epidemiologists call today as spatial cluttering as we know it. And it is still an example of the very first things that investigators actually look out for when any outbreak happens today. Okay, but I'll just take you to a very important and a very interesting part of this map, right? So as we saw, there was spatial cluttering of the cases in between, but I'll urge you to look at two very special spots in the map. So is my cursor visible? So uh, I'll show you
Uh,
this very spot or this very house on the right side of the map, right? It's
yeah.
labeled as a brewery, and this very unique place in the center of the map, just a few feet or a few 100 meters away from the main pump under question, That's termed as a workhouse. So that building to the right of the map, right? It's in the right of the map, and can you see any cases nearby? And there aren't any deaths at all, right?
That seems like it breaks your whole theory. If it's the water, why was this place spared?
Good instinct nonetheless, and a very lovely question. And that's exactly what again Jon Snow asked. It looks like you are the Jon Snow of today's generation, my friend, and the answer actually turned out to be very delightful and lies in the details of the story. So the building first, which we saw to the right of the map, was actually a brewery. And if I ask you from this picture, what kind of a daily allowance do you think the workers of this brewery had?
Let me take a guess. A perk that made Monday mornings more tolerable? Free beer, right?
Absolutely, absolutely. And beer it was, and a generous ration of it, right? As is visible from this picture. And actually, they also had their own on site well as well. So they barely touched the public water supply of London.
So wait, let me get it straight. Beer actually helped?
No, absolutely. In this case, it appears so. And in this very unusual circumstance, surprisingly, yes. Not because of anything magical in the beer itself, like these workers would have presumed, but drinking it meant that they weren't drinking the contaminated water from the pump in question, number one. And secondly, it also had an accidental protective effect. And it's exactly the kind of exception that makes an epidemiologist pay attention rather than completely outrightly denying it altogether. Okay? And coming next to the center building in the map, like I showed you, so this is the actual picture of it. And in here, we saw a second exception, which was as telling as the brewery. This was a workhouse, and right in the middle of the outbreak zone, it housed hundreds of residents. So, do you feel that there's a pertinent pattern in here again?
I don't see it. Like a crowded Victorian workhouse of all places somehow does this slaughter. I don't believe it.
Absolutely, and there weren't any barely deaths nor cases around. And it turns out this workhouse also had their own private well, which was completely separate from the Broad Street pump.
So, two groups, similar area, different water source, wildly different outcomes.
That's very well put, and without anyone naturally designing it in any way. London had actually accidentally created what we now call a natural experiment. Two comparable populations, like you put it, split by a single variable, which was the exposure to the water source, producing two very different outcomes. And this, my friend, is the strongest evidence in the whole investigation. And Jon Snow hadn't engineered a single part of it. He was just careful enough to notice it. So, armed with his map, he went ahead, he took interviews, and he spotted these two natural exceptions, and he took his evidence to the officials, the then parish vestry, and he made one simple request. Tickle your grey matter and just tell me, what do you think should have been the request?
Okay, so the ultimate low tech intervention, just immobilize the pump.
Absolutely, absolutely. And so they did. After they understood these varying outcomes, they ultimately went ahead and took the decisive act, rather very complacently, but they took the handle of the pump and they made sure that no one could draw any water from it. And the people from the parish actually listened to him, although not fully convinced. But the exact date, as the records of public health mention, is on the 8th of September 1854. And thus came up the handle. And soon after, the cases in that particular area, I'll tell you, showed a great plummet, right? And but there's a slight nuance, if I may tell you. So the nuance which the historians actually add in this case is that By the time the handle was removed from the pump, the outbreak was already set to die out and was actually waning. And many residents had actually fled the current area of Soho, right, for obvious reasons. And the epidemic, as we would put it in the form of its graph or its curve today, would actually past its peak.
Wait, so the handle did not actually stop it?
As popular folklore from public health goes, its precise impact on that one particular outbreak is still very widely debated. But that's not actually why this moment became iconic. What made it more revolutionary was the actual method. There was mapping involved, there was data interpretation, there was careful observations which were made, and the intervention to act upon a disease before anyone could see it under an actual microscope. And the idea did not stay in 1854. The question which I'll ask you now is: Do you think uh, we still use it in practice somewhere? Can you give me an example of the same?
Mm, maybe in the recent pandemic, COVID-19.
Okay, go on, go on.
So maybe during that, the disease was clustered around a particular area. And when it was clustered, there is a technology called GIS, the Geographic Spatial Analysis, and it would have given the flashes of new upcoming outbreaks in a particular area, which would authorities to take preemptive actions or interventions.
Absolutely, absolutely. Spot on, my friend. And not very surprisingly, the underlying reasoning remains absolutely the same, right? So whatever John Snow used, we are actually using it on technology. We find the pattern, we follow the evidence, and we act before we have the answers, right? So obviously, John Snow then did not have the modern laboratories, neither did he have any pertinent computers or even the germ theory of disease over which he could work on. So, to explain actually what he found, uh, and what I'll ask you is that, Rachit, tell me what was his actual, strongest weapon or armamentarium in this entire episode?
I think the best tool that he had in his toolkit would have been the map.
Absolutely. The map was one very good, very strong armamentarium, and the even stronger aspect in this regard was his sense of curiosity and his careful observation and the courage to question something which everyone else just accepted as it is. And sometimes, like in public health and medicine, the greatest breakthrough actually began with nothing more than a better question. So, speaking of better questions, like we saw today, if removing a pump handle could change public health forever, just wait until you hear why quarantine lasts for 40 days.
40 days? That is oddly specific. Don't leave me
For
hanging.
I'm sorry, but I will not be able to do you the honors in this episode. And to answer that question, do tune in for the next episode of Public Health Chronicles. We plan to make it into a fortnightly series, and please pour in with your comments, your constructive criticisms. This is a new beginning altogether for IAPSM West Bengal chapter and for us. And hope to see you. Tune in for the next episode. Thank you.
Thank you.
And thank you so much. All the viewers, please like, share, and subscribe to the channel to know all these very interesting answers to these very different questions. Thank you once again as we sign off from IAPSM West Bengal Chapter, the newest series on the block, Public Health Chronicles.